So good evening, everybody. Thank you so much for joining in. I'm excited to have you on the call. This is a presentation of the Durham Committee on the Affairs of Black People. Mr. Omar Beasley is the chair, and the slogan for the committee is to protect, inform, lead, and empower. And if you'd like to see more information about the Durham Committee on the Affairs of Black People, please visit the web address that you see there. And tonight we're going to talk about COVID-19 and the Black community. There's been so much talk recently about the impact of the coronavirus on the Black community. And for those of us that are Black, it's no surprise. It's like, okay, thank you for catching up. But there's some foundational things that we can do to help ourselves. And that's really what we need to do. So the individual and collective response, how we're going to protect ourselves as members of the Black community here in Durham, and hopefully some of this information will be helpful and useful for your loved ones that are in other states and cities across the United States. So I am so thrilled and excited to have a content expert, absolutely expert, in this field of health disparities, and equity. He is sought out and sought after as a guest speaker and a provider of information on this topic. And so Mr. Cornell Wright is the executive director. I hope this is the right title. The executive director of the Department of Health and Human Services Office of Minority Health and Health Disparities. You can correct anything that's wrong with that. But so Cornell, please go ahead with your part of the presentation.
Thank you, Dr. Boone, and you got it correctly. So you're good.
Okay, good.
Good evening, everyone. I bring greetings from the North Carolina Department of Health and Human Services Office of Minority Health and Health Disparities. We want to change our name soon, so I always have to catch myself and make sure I don't say the new name before it's time. But bringing greetings.
Want to give us a sneak peek?
Well, we want to take off the term disparities and put equity.
Yes. Okay.
But want to bring greetings from our secretary, Dr. Mandy Cohen, and our deputy secretary, Mr. Ben Money, as we start this journey of talking about what's going on in our community and how we can be connected to the right resources, the right information, and distribute that out to our people. So what I will do is just kind of go through some things, and then we'll have a discussion if time allows. And what I will also do is send a copy of my slides that you're not seeing to Dr. Boone, so that you can have a basis of information and some hyperlinks you can go to and some resources you can be connected to after the call, if that's all right with you all. Mm-hmm. So quickly, I do want to kind of just raise up some key terms and definitions. When we talk about health equity, we're talking about the opportunity for all people to have good health. We talk about those unfair differences that prevent that from happening, and those are the health inequities. And the way we measure everything, we call it disparities. So when we're comparing like one group to another group or one thing to another thing, the measurable distance or gap between what we're measuring are known as the disparities. And a lot of what we see is based on what we call the drivers and determinants of health. And these are factors that can greatly influence our health and well-being, especially in our communities. A major component of what we're talking about is making sure that we know there's a difference between equality and equity. Equality is giving everybody the same thing, and equity is meeting people where they are. And so when we start having those conversations, we see the need and understand the need for people in communities, especially of communities of color, to be at the table, to have a seat at the table, and along with having that seat at the table, having a voice with that seat. So it's important, as we see in, especially in Durham, around some of the campaigning of health messaging, of getting in the game. We have to make sure that we're also able to play the game along with everyone who can influence our own health outcomes and have a say-so in how that is put forth. So some of the barriers we're seeing across the board is access and opportunity, especially access to quality care, access to quality insurance. Sometimes we're seeing people having no insurance or not enough insurance. And that is one of the bigger issues that we could talk about moving forward, but also transportation, workforce, finances, education, fear and mistrust, and myths and misinformation. And we'll go really a little bit more into the myths and misinformation, because there's a lot of conversation around COVID that that started and just aren't true. I mean, we've heard so many different things about what this thing can do and cannot do that's not based on actual data. And so in actual fact, in practice. So we have to make sure that we're not pushing the wrong messages around in our community, because then that can widen the disparities that we're already seeing. And so based on geographical location, that can also be another barrier. So I know in Durham, we're more of a, I guess, like a metropolitan type of area, but there are still pockets of the county and the city where we see pockets of poverty, and we see areas that don't get the resources like we would like to see everyone get. And so where you live can really change your health outcomes. And it's even more of a problem when you start thinking about more rural areas and areas that have less resources. So we have to be very mindful of things like where we live, but also things like our proximity to good quality food and food access, and not getting lost in all these long-winded terms. And so the need for plain language when we're talking to our communities so they can understand and digest what we're talking about is so important, especially in these times. So when we think about the drivers and determinants, things like environment, education, housing, transportation, healthcare, food and nutrition, violence, and poverty are a lot of what comes to mind when we're having these conversations of what can greatly influence our health, and where we need to start having these conversations that we've been having in our communities, and it seems like the rest of the world is trying to catch up now, which isn't necessarily a bad thing if we're going to get more resources brought to the table to help our communities. And so one thing I want to make sure that we understand out loud is that being Black is not the risk factor. So your race is not the risk factor, but it's the way we've been treated historically because of our skin color is what is the issue. And that's what we call racism. Racism in this context is systems of unshared power that keep going on and not being checked. And so we have to make sure in these times that we are addressing systemic racism and changing systems wherever we can, because again, these are not new things to us. Whether they might be getting a 24-hour news cycle now, we've been living with these issues and problems throughout. So when we think about some of the things we've been hearing around COVID-19 in our communities, we want to make sure that we are looking to the right resources. And so one of the resources is out of the Department of Health and Human Services, where you can go to ncdhhs.gov/coronavirus and get all the information and guidance that has been put forth, and it changes constantly. So it's a good resource to have, and we'll say it again later as we're talking. But when we're thinking about what we're seeing and hearing in our communities, I would love to hear what you're hearing, and see how we can help with that information. One thing that we've seen through our dashboard is that African Americans are the second highest contaminated or affected population in this state, and possibly in this country, because when we look at the data that's available to us, that's what we're seeing. We're seeing a state of North Carolina where Black people make up 21 to 22% of the population, but we're also seeing about 38, 39% of COVID-19 deaths in our population as well. So it's something that we have to address. It's something that we really need to connect our communities to, and making sure we're adhering to the guidelines put forth by DHHS, the governor, the Center for Disease Control and Prevention, and the other trusted sources in our communities. So we have been looking to the community, not only to give them information, but to share information, as well as understand what the community is seeing on their end. So we've been working with the local health departments. We've been working with faith communities, working with civic organizations and grassroots organizations, as well as other community organizations, to get the word out, but also understand how we need to proceed with our messaging, and making sure that we are not, one, reinventing the wheel, but two, not overstepping our bounds in communities, and making sure that we remain a trusted source for information. And so there, I'll pause and see if we can have a conversation of what is it that are some of the burning questions that you all have, and then what are you also hearing in terms of what's going on in the community on your end.
And Mr. Wright, if we could hold the questions for just a moment.
Okay.
Some information that I wanted to go through, but let's go ahead and take a couple of questions at this time, and then I'll go ahead with some information that I have to share and have questions also at the end. So does anyone want to share what they've been hearing, or, and that's the specific question right now about the coronavirus? Okay. So there are a couple of things that I wanted to share. And so first of all, what is the coronavirus? I think we've heard enough about that so that we do understand what it is, but how it works is that it is spread by shedding these particles by sneezing or coughing and that kind of thing. So those droplets actually are protein. They have a thin layer of fat around them. So they lodge in the nose. And that's why when people get tested, they get tested with a swab through the nose that goes to the back of the throat. And so the virus attaches to the back of the nose, the back of the throat, and then ultimately goes down to the lungs. And that's where the problem is. One of the things that I do want to mention is that if you know of teenagers that are vaping and causing problems with their lungs, then that's something we need to look out for. The symptoms are a fever, a cough, shortness of breath, sore throat, headache. First of all, making sure that we don't have a fever. That's number one. And so because of pollen and allergies and that kind of thing, we may be experiencing some of these other things, maybe not shortness of breath, but headache, sore throat, and a cough. So we just want to make sure that we check our temperature. And it feels like this, the physical distancing, which we don't want to call social distancing because we can still be social. In terms of the data that Cornell mentioned a little earlier, this is from the dashboard. So you can see some of the information that's on the dashboard, and this is for across North Carolina. So Mecklenburg County is number one, and of course these are larger, Wake County and Durham County. And this data is updated every single day. So this is even old news right now. So you see the number of tests that have been completed as of this posting, which was day before yesterday. One of the things that I wanted to point out to you has to do with race. And we talked about that a little bit already. So Black or African American, 785 cases across North Carolina. The number confirmed, oh, wait a minute. Let me think about this for a second. Yeah. The number of deaths and the percentage. And you can see the others, white, 1,175, 67% death. Over to the right-hand side, the 2s, the 3s, the 4s are just references that are on the bottom of the page. So it doesn't refer to the number of rest homes. But there are 9 nursing homes that are seeing outbreaks, 3 residential care facilities, and 3 correctional facilities. By age, this is really important as well, because one of the things that we have heard and understand is that people who are over 60 are most at risk. And according to this data, again, from the website, 42% of the cases are from people who are 25 to 49 years old, which is relatively young. And laboratory confirmed cases by age 65 plus, we see as 20%. But when we look at the number of deaths by age, young people may be contracting the virus at a higher rate, but folks who are older are dying from the disease or the virus at 80%. And so it's important for us to adhere to the rules and executive orders that we've been given from the state and from Durham County, Durham City. Of the confirmed cases, 48% male, 52% female. And deaths by gender, 72% male, 28% female. And so then we begin to see some disparities and ask the question why. One of the things that we need to do are all these things that are listed: wash hands, stay at home, disinfect, use a tissue, or use your elbow inside of your elbow, and use a face covering. Now, one of the things that I want to point out, because this changed a little bit, and I had a conversation with coalition members yesterday, that now gathering gatherings of more than 5 are not allowed. So now it's 5 people and not 10 people. So in the recent past, we were able to gather in spaces of, in groups of 10. However, we're still supposed to maintain that distance even with 10, but now it's 5. One of the questions that came up had to do with barbers and beauticians and masseuses. And so it was thought that if you are cutting the hair or doing the hair of a relative, that you are all right, but that's a relative within your own home with whom you are sequestered. So a person that is a barber, a beautician, or a masseuse cannot leave their home and do hair and cut hair or provide massages and that kind of thing. That's something that's not allowed in the rules. So the other thing that I wanted to point out, and I'm going to go really quickly because I know that we need to have a very robust conversation. But one of the things that I wanted to stress in terms of our individual and collective response is that as Black people, we need to understand the burden of historical trauma and how that historical trauma results in daily stress, and it can hurt our health. And the way that we treat each other as a collective community, we need to be really aware and think about that, because we do not want to traumatize or re-traumatize one another. And that brings me to McDougall Terrace, which is pretty much on my mind every day. We do a lot around helping McDougall Terrace residents that have been displaced. But I want us to take a moment to think about how strong these families, these residents have been. Because long before coronavirus, they were removed from their homes, placed in hotels, motels, and having to live in one room with an entire family, which could be a family of 6 or 8, and even if it's 4, I think we have a greater appreciation and respect for what they have been through. And I just want us to be aware that what we thought that McDougall Terrace residents, we may have thought that they should have been able just to, muscle through this, and now don't they have a nice hotel to stay in? What are we saying now? When we are, we have to stay at home within our family units for 30 days. How long have they been in hotels? And so I just want to, give a shout out, give my appreciation, give my thankfulness that they have been able to endure, and they may be able to teach us some things during the COVID days. There are traumas that take place in households, in communities, and in the environment. And you can see in this picture what some of those household traumas are. And Cornell mentioned some of the things that take place in communities that are traumas: violence, lack of jobs, poor housing, substandard schools, historical trauma, lack of social capital and mobility. But then there are environmental traumas that have to do with exactly what we're going through now, but in the past, we see those traumas in natural disasters. And some communities never come back from some of those environmental natural disasters. So you can see that as Black people, we can have and do have traumas in all 3 areas where others may not be so affected. some of the traumas have to do with adverse childhood experiences, and they're going to be, I'm going to have teleconferences every week for the duration of this epidemic. So what I'm going through really quickly, we'll hone in on in other teleconferences. So there are 3 types of adverse childhood experiences. If before someone's 18th birthday, they experience physical abuse, emotional abuse, sexual abuse, physical neglect, emotional neglect. If in their household before their 18th birthday, mental illness, mother treated violently, divorce, incarcerated relative, substance use, then, and if there are 4 or more. So the key number is 4. It doesn't matter which 4, any of these 4. So we're going to have an entire teleconference on adverse childhood experiences and how we deal with that through resilience. But if before someone's 18th birthday, and the things that I'm talking about now are things that we're focused on in the Health and Safety Committee of the Durham Committee on the Affairs of Black People. So hopefully you will join our committee so that you'll be able to share this information with others. So if there are 4 or more, then what we can see is lack of physical activity, smoking, alcoholism, drug use, missed work, severe obesity, diabetes, depression, suicide attempts, STDs, heart disease, cancer, stroke, COPD, broken bones. So if someone has 4 or more adverse childhood experiences before their 18th birthday, then they may be susceptible to these behavioral and physical and mental health outcomes. And so already you're seeing a picture of how physical and behavioral challenges can weaken our systems so that we could present with some of the physical ailments that we're told can hurt us during the coronavirus. And then also, what kind of communities have we lived in? Do we live in a healthy community or an unhealthy community? Notice that I'm not calling the people healthy or unhealthy. It's the built community that is unhealthy. And so again, we'll have a whole conversation around environment. Blacks in North Carolina are 2 to 5 times more likely to have bad outcomes across systems in North Carolina, any system. So painting a picture of why Black people are more affected by the coronavirus or just in poor health, period, we see the trauma from personal, environmental, and community issues that have caused our health not to be the best that it could be. And so what we want to do during this time is to also regain our power in terms of our health as we continue to fight for justice and social justice in the other areas that we need to address. And really, when we think about it, if we're not healthy and we are not at our fullest potential, then we may be limited in how we fight. And we want to fight and advocate together. And part of that is being healthy. So as we saw, stress has a lot to do with heart disease, diabetes, cancer, colon cancer, as you saw in the previous slide. The impact of diet, we'll talk about that. I won't go into this very much, but we need to get a handle on what we put in our bodies. And we need to pour into ourselves. One of the things we have time to do, or we should make time to do during these 30 plus days, is to think about how we can take better care of ourselves. So what we want to do for all of us is to create a safe environment, one that practices more thoughtfulness so that we don't re-traumatize people. We need to listen to people. You know, I think we're so separated in our ways of communicating that we don't really take time to listen to each other, but we have preconceived ideas and notions about people, and therefore we're unable to listen to them as we should. And so we want to make sure that we do that. Creating collaborative relationships and participation opportunities as we're doing tonight. Important thing is, the question is not what did you do, the question is what happened to you, and you're more than the worst thing that ever happened to you. Resilience, which is the key to doing well after trauma, has to do with behaviors, thoughts, and actions that can be learned and developed in almost anyone. So, in terms of the coronavirus and us being in the house with people that we love, but we're with them all the time, there really is such a thing as cabin fever. And as we think about historical trauma, which are events that are done with a genocidal intent and result in annihilation or destruction of traditional ways of life, culture, and identity. So we have that on our plate. And historical trauma can be embodied in our DNA. And so again, we have to do what we can do as a community to make sure that collectively we are looking out for each other as never before. We deal with microaggressions and injustices on a daily basis. They can be indignities, intentional or unintentional, racial derogatory actions, purposeful discriminatory action, micro insults, insensitivity, unfair treatment, demeaning identity or heritage, and micro validations are things that nullify, exclude, or negate the experiences and identities and thoughts of other people. So we have a lot to deal with that we will do in other teleconferences, webinars. But the signs of cabin fever are restlessness, lethargy, sadness, trouble concentrating, lack of patience, food cravings, decreased motivation, social isolation, difficulty waking, hopelessness, changes in weight. And remember that the people that you are in the house with, separate from you, are experiencing and might be experiencing the same thing. We should limit our intake of the news, limited. I'm not saying don't listen to it. And then make sure we have a mental health check-in. And this is something that you can do with every member of the family, whoever's in the house with you, and even on your own. Remember the saying, put the oxygen mask on yourself before helping others. And so help the young people that are in your home, yourself, others, to identify how they're feeling every day and then react accordingly. So if someone is starting to struggle, instead of just figuring, okay, they'll get over it, no, have a conversation. If they're having a really hard time, then bring somebody else in. If they need to reach out for support, then we want to make sure that we have the phone numbers, which I'll make sure you get, that are appropriate for addressing those issues, and then create space for yourself. Even if you have to take 5 minutes, and you can put a sign, 5 minutes, I'm taking 5 minutes, give me my space. It's really important to have good sleep, because poor sleep puts the brain on guard, and it triggers stress hormones, and it causes anxiety even before the day begins. And so we need to prepare ourselves for that sleep. Create a schedule, especially Monday through Friday, because days can just run into each other. What day is today? It feels like Saturday. Every day does. And so we have a calendar, but certainly you can make your own calendar that will remind you, and I'll send this out too, if you send me a message. And so that you can have something to reflect on every week, and some activities that you choose to do during the week. And so these are just some things that I wanted to let you know about. Lastly, while you are at home, remember the shoulders that we stand on. There's a website that is called www.archives.com/1940 census. And you can put the name of your loved one. This is my mother's name, her maiden name, and where she was born in South Carolina. So where was my mother and what was she doing in 1940? And just so you know, that's before I was born. So the census, that census, and let me just go back one moment so you can see it again, www.archives.com, 1940 census-census. Okay. And so this is the information that will come out. Birth year, where born, first, middle, last name, age at time of census. So I found out that my mother didn't tell the truth about her age. She said she was born in 1925. Okay, but that's all right. And then it will also tell you over to the right-hand side, everybody that was in the house at that time. So my grandparents, all of her brothers and sisters, my mother and me. And so that is, it's free. And it's just, I think many of us are feeling nostalgic right now. And so it's just a great time to think about our relatives and reflect on who they are and maybe share that information with others. I'll go back to that. Okay, so let me see if I have, sorry about that. Okay, so what I want to do is to open up the lines for questions. I know that I went through those slides really fast. This is being recorded, so I'll be able to make sure you get a copy. So anyone that has a question, please feel free to ask it at this time.
I have a question for Mr. Wright about the data that's being used in the dashboard. That
Yes, ma'am.
my name's Lauren, by the way. That it's showing that about 1,000 of the cases that have been reported don't have detailed demographic data.
Yes.
Do you guys have any sense of if that data was in, the number disparities would be bigger, or can you just talk about why that data is not there?
So with the monitoring measures, race and ethnicity are not required. And so that's why you see that there's over 1,000 cases, almost 1,100 cases that don't have that data at all. And so we fought for our office, we fought to make sure that the data got out there. There are a lot of states that aren't even sharing any of the data on race and ethnicity. And we said, look, we got to at least share what we have. And so for your other part of your comment question, we don't want to speculate one way or the other, but we do have a pretty good sense that we have about maybe 2/3 of the cases that we can track that have race, ethnicity, demographic data. And so that's where we can get the numbers that we do have to give to you, but only a handful of states like North Carolina, Michigan, Virginia, maybe Georgia, maybe Illinois are even sharing demographic data by race and ethnicity.
Thank you.
You're welcome.
Is there another question?
This is Howard for Shed. I'm glad that you all explained the difference between the symptoms of the virus and the symptoms of having allergies with all the pollen and everything. So That was very helpful.
Great, thank you so much.
And to that point, it's been almost like the scarlet letter when people cough or sneeze. And so we have to be very careful. I was outside. So just to be truthful and transparent with you all, I'm one of those people that are at high risk, due to my medical situations. And so I haven't even left my driveway in God knows when. And so we were outside with some, talking to our neighbors as our kids were, in the streets, practicing physical distancing, but having a social time. And one of our neighbors started coughing, and we all looked and stopped talking and stopped doing what we were doing. We're like, you good? Now, they were in their respective yards, and we were in our yards, but still, it's one of those things that we start to pay attention more to people coughing and people sneezing, and it's allergy season. So, we just got to be mindful that we're not looking at people as pariahs just because of something natural due to the time of season it is. So I'm glad you brought that up.
And I want to say a little bit about what the symptoms are really like, because remember, there's some people that are asymptomatic, which means they don't have any symptoms at all. But a friend of mine said that she woke up, and remember the description is that the virus goes through the nose, clings to the nose. It has like little spiky things on it. You've seen pictures, right? So it clings to the back of the nose, then it goes to the throat. What she said was that she woke up with a clog, feeling like a clog of mucus in the back of her throat, where she was afraid that she wasn't able, that she wasn't able to clear it, and that she could only say 10 words without feeling a shortness of breath. Now, I'm sure that is a more extreme example, but anytime there is a feeling of pressure on your chest, and people who've had pneumonia know what that feels like, but this is it clogs. It feels like a clog that you can't get rid of. And so that's why when it goes to your lungs, that's why so many people need respirators, because they're unable to breathe with that much congestion in their lungs. If you have a high fever with the coughing, with the headache, with the, then you should go to, well, what we're told to do is to call our primary care first, and then go to the doctor. Lincoln Health Center is the place where people should go who don't have insurance. And if you go to their website, it says to call your primary physician first. If they can't help you, give us a call, and then they will walk you through it. What I told people yesterday is that I have not done a quality assurance check on that, and we'll do that to see how difficult it is, how backed up they may be, or what the situation is if someone doesn't have insurance and needs to go to Lincoln. Are there other questions, please?
Okay, I just have one more. I have one mask, and I always forget to take it with me. It's a mask that I've had for years. It's still in plastic, that I bought from Lowe's, and it's a mask that I bought because of the pollen, when I work outside. Mm-hmm. Now, when I go out to the grocery store, I see all types of things that people are wearing now, things that are homemade and things that people bought. Is there a mask that you shouldn't wear? Or
well, part of the regulation, recommendation is to have our faces covered.
Okay.
And so, so my wife is a microbiologist. So this past weekend, she spent time on the sewing kit making some face covers. So there's a difference between the face covers and the mask. That, you know, like when they start talking about PPE, those are the things that like medical professionals need, those type of masks to effectively protect themselves in clinical situations. But part of the recommendations are that if you're in public, like in the grocery store, they want you to have your face covered so that you can slow down, prevent, or stop the spread of anything, any contaminants to other people while you're practicing physical distancing. So you'll see a lot of different variations. My wife, when she made hers this weekend, she was using African cloth that she had been gifted. And so you'll see people using bandanas. There are also tutorials that you can find on social media on how to make your own face covers. And then also using things like air filters to help with some of the extra accessories to put in to your face covers.
So those of you who are on the call, and if I have your email address, the Surgeon, and many of you have seen this on Facebook, but the Surgeon General actually has a very short video that shows how to make, excuse me, a face covering in 45 seconds. And the idea is to have cloth that is washable. And so, and you can use t-shirts but anyway, so as Cornell just mentioned, there are some things on Facebook. Remember that it needs to be cloth. And even when you are wearing them, you still need to maintain your 6 feet of space when you're in those larger settings. And, you know, you may just have to tell people, back up. So are there any other questions?
And you know what? It's funny that you say that because I always have that as a pet peeve of mine when I'm in the grocery store.
Yes.
There are certain people in certain populations that are just too close to me in the grocery store. And so maybe this is something that will help prevent my pet peeve from being more a reality in the future. But it's also, we're seeing in our community how touchy-feely we've been, especially when it comes to the way we worship. And so this is a new normal for a lot of us, or just the way we greet each other has turned from hugs and handshakes to head nods and elbow bumps, even if you're that close. And hopefully you're not that close now, but it's been a reality check for a lot of us, just because of the physical nature of how we have been historically and culturally.
And just to make people a little bit more comfortable, I hope, is that when we say neglect not the assembling of yourselves together, and some people think of that as being physically together, and if you're not physically together in a building, then that is a problem with your faith, and it's not. If you are listening to a service with other people, or you're on Zoom in a service, then guess what? You're together. And then, you know, of course, relationship is what we want to focus on. Are there any other questions? Okay, well, as you see, we're going to count down 30 days together. Now, when I say weekly work, they're not assignments. They're touch points with action, so that when we come out of this, we'll come out of this more unified and together in terms of our health and safety. We're focused on the data in our Health and Safety Committee for the Durham Committee on the Affairs of Black People. And so I really want you to be a part of what we're doing. And we picked the data apart, especially looking for disparities and trauma and asking questions. The question that I asked, that I sent to Cornell was, do you know if there's any data that has to do with African Americans and the coronavirus? And he was looking for it just as I was looking for it. And then I also called Congressman G.K. Butterfield, and he said it was timely because he was just in a committee meeting that was requesting the same thing. And the same day that the question was asked was the same day that Cornell came back to me and said, we have data. And he sent me the web address for that. And that was just a few days ago. So we quick, fast, and in a hurry put this telephone call together, this Zoom call together. And I'm so glad that you were able to join. In closing, I want to read this to you because it's something that I live by, and it's the way that I think about the work that we do and the work that we connect, how we connect. There was an anthropologist who had been studying the habits and culture of a remote African tribe. He had been working in the village for quite some time, and the day before he was to return home, he put together a gift basket filled with delicious fruits from around the region and wrapped it in a ribbon. He placed the basket under a tree, and then he gathered up the children in the village. The man drew a line in the dirt, looked at the children, and said, "When I tell you to start, run to the tree, and whoever gets there first will win the basket of fruit." When he told them to run, they all took each other's hands and ran together to the tree. Then they sat together around the basket and enjoyed their treat as a group. The anthropologist was shocked. He asked why they would all go together when one of them could have won all the fruits for themselves. A young girl looked up at him and said, "How can one of us be happy if all the other ones are sad?" Ubuntu. And so I hope, with all the hope that I have, that this will be the first of many conversations where we see each other as Ubuntu, where we don't see each other in our silos in the work that we do, but rather we see how we can bring all of that work together and actually make a difference for each other. This is such an important time. We want our community to live and have the best life. So that means that we take care of ourselves, we take care of others, and then we come out together in a more unified way than we might have in the past. So, oh, there they are again. So thank you so very much. I appreciate your being a part, and I'll send out a notification of the next time that we will be meeting together. Thank you, everybody. Have a good day.
Thank y'all so much.
Okay.
Thank you.
Thank you.
Bye.
Thank you so much. Bye-bye.
Thank you. Bye.
Bye.